record. Great. Well, good morning, good afternoon, and good evening, Shiatsu therapists all over the world. Welcome to another episode of Everything Shiatsu, another great guest. Hope your week has been great, wherever you are, and you're doing well. And I'm so grateful for those that are joining us here live on Zoom and live on our Facebook group, Everything Shiatsu. If you're seeing this live on our group, can you please comment and let us know where you're from? Say hi, like us, just to help us with the algorithm. That'll be great. And as all of you are aware, we've been through a very difficult few years, of course. And many on this show have done tremendous work throughout the world in supporting frontline workers, in particular here in Canada. There's been a big issue right now, recognizing that a lot of the frontline workers are burnt out, traumatized, they're quitting their jobs. So the frontline workers are crumbling. And I know also, and been inspired by previous guests with initiatives in Argentina, in Austria, in Israel, and other parts of the world, in Hungary, where Shiatsu therapists have came out and supported the frontline workers during the pandemic and continue to support. And that's why I want to highlight my guests this week, Monika Zobel, all the way here from British Columbia, Canada. Monika Zobel and myself know each other for a while, and she has a lot to share with us too from her experience supporting frontline workers during the pandemic. So welcome, Monika.
Hi, welcome everyone.
How are you, Monika?
I'm good, thank you. You well too?
So let's, if you don't mind, if you can share a little bit about yourself too, so people get to know you, your journey from a nurse to a physiotherapist and then a shiatsu therapist, if you don't mind.
No, sure. The journey started early. I was already 15 when I started working at or volunteering at the hospitals because I just liked to do it. I also had a grandfather who was a male nurse, which I thought was very inspiring, and it was, I loved it, and people met him on the street and greeted him, and they were so happy that he would take care of other people. But anyhow, I volunteered, I liked it, and I started working as a nurse right out of school and did my nursing exam in 88 already, long time ago. And then I worked in ICU. I did a lot of orthopedic surgery stuff. I did a lot of internal medicine, neurology, all over the place. And then I decided after traumatic experience that I had after an accident, I was on the same intensive care unit I was working.
Wow.
And it was tough for me then after that to keep on working, apply CPR, doing all the stuff that you need to do. So anyhow, I decided to switch hospitals, learned everything about hip, knee replacements, spine injuries, all of that. But I then turned to become a massage and physiotherapist, which I absolutely loved. And it was great to have the background of nursing, now to being focused more on anatomy, physiology, kinesiology, all of that. And that was great. And then whenever I had time and money, I took all the courses you can think of, starting with reflexology and hydrotherapy and osteopathy courses and everything. And then I finally found a school that was for medical professionals in Friedrichshafen, Germany, the International School for Bo Meridian Shiatsu. And still remember my first class I went in and I just felt like I'm home. That full holistic approach of everything that I've learned through so many courses. So I started that in 96. after working as a physiotherapist for a few years. And yeah, it was great. I graduated in 99. And since working as a physio in hospital settings as well, I was able to integrate Shiatsu into my physiotherapy practice. And I was doing seminars and teaching my fellow students and fellow colleagues about Shiatsu, and no, that was great. And then in 2000, my now husband and I decided to go on adventure and to immigrate to Canada. And so since then, I'm in Canada. I'm in BC, in Vancouver first, and now in Kelowna. And after some struggles to be recognized as a Shiatsu therapist, I am now a registered, or since 2000, I'm a registered Shiatsu therapist in BC.
Fantastic.
Yeah, and same journey. I mean, I'm still doing courses whenever I can, whenever I have the money. I'd like to integrate it. I feel I'm a bit of an anatomy freak. I love it. I love to use Shiatsu, some other tools. I love to see it as for me, the body is like a puzzle. And the more I understand every single piece, I can fit them together and have a nice balanced picture at the end. So that's about where I come from. And since I'm here, friends of mine and clients of mine are doctors or dentists or fellow therapists. They could be myofunctional therapists, they could be RMTs, physiotherapists, and we work together, we share. I participate in a lot of groups to learn more about diagnostic and diagnosing people, and yeah, all about all that stuff together.
Beautiful. And yeah, you have a few two daughters too?
Yeah, I have two daughters and of course a husband.
Yes, yes. You're a busy woman. Now, since the pandemic, of course, many of us couldn't work, and we experienced what we experienced. What was the initiative for you or the impetus to be of service to those frontline workers? How did that happen? If you can share that with us.
I mean, before I did that, I also, for the community, it's an initiative from the University of Victoria, and I was leading pain management courses. So chronic pain management and cancer thriving and surviving courses.
Fantastic.
6 weeks courses, and it was great to already work with the community and give back. But my big thing was on my way to see a client. I have a mobile service. I drove by the hospital and there were all those protests and people were banging at my car asking me for support. And I was so shocked to see people blocking the hospital and being rude to nurses and all of that. So I was just beside myself, and I came home, and a neighbor of mine, he's a doctor at the hospital and we are good friends. I just said, hey, you know what I do? I'm happy to make a difference, because the way they are treated right now, they went from hero to zero. It is not right. And they are taking care of us or other people. I would love to come in and give free treatments. And he was surprised but happy about my offer. And he got me in contact with someone of his staff and the manager of his department. And within 2 weeks, I was allowed to go in, and all I needed was a chair and a small corner. And I started working or offering Shiatsu treatments. And the short treatments that I do are about 10-15 minutes. But it sure makes a difference. I mean, it's unbelievable. They are happy to see me. They have a different mood. They feel so much love and compassion, and they say it gets them through the day. And a lot of them share their stories with me, how they felt during the pandemic and still what it is now. So yeah, so I did that for one department for a while. Then I'm now including the ICU. So I'm going to ICU nurses, the whole staff, doctors too, every 2 weeks. And so 1 week I see the OR staff, 1 week I see the ICU. And after a few months, I want to expand that to other departments because I think if they see me a couple of times, it's better than just
Yes.
showing up in every department. And what happened too was that the hospital then for appreciation days started to hire me on the side beside my volunteering, just to spread the word because they thought it was really cool what I was doing. And that also gave me the opportunity to talk to managers and doctors about Shiatsu. And
Incredible.
yeah, my medical background helped to explain certain things, but they're so happy. And I think it would be just, it's the best thing, you know, we can help everyone, but everyone can help someone. And if
Yes.
we are able to show how beautiful Shiatsu is and how much effect you have with just 10-minute treatments. You should see them even energetically. They sit down and their headaches are gone, or their shoulders release, or they can breathe. They have
Yes.
that pause that they need in order to take care of other people.
Yes.
And that's beautiful.
What kind of questions do they have initially? I mean, because I know doctors can be skeptical sometimes to anything that is new, and obviously it helps having a medical background like you to explain it. But maybe you can, from that background that you have, maybe you can share how you explain it to the medical community.
I mean, I start working, I love working, depending if I have a chair or if I use my massage table, my massage chair. They sit and I just start top of the shoulder, cranial base, and work a few points there. And then I'm just like, is that the right pressure? How does that feel? And they were kind of, oh, wow, that feels good. That's different. Nobody touched me like that before. And I'm kind of, well, you probably heard of acupuncture, but the points that I'm using, they are similar than there are acupuncture points, but instead of needling them, I'm pressing them, I'm connecting them. And they were just like, oh, I feel that line. And I said, well, that's a meridian line that you feel. You know, you work with them or you ask them also, how do you perceive it, you know, and how is it for you? And then I say,
Mm.
well, it's called Shiatsu. Shi means finger, Atsu means pressure, and it's around for a long time. It's even regulated in Japan as its own health therapy since the 60s. And they're just like, oh, wow, and where did you learn that? And then we talk about the school I've done or I've gone to. And then I usually add in a stretch or a meridian stretch or a neck stretch. And they're just like, oh yeah, they can, the coolest thing is if they feel the meridian line and they're kind of, oh, that's really weird. Why are you pressing me on the top of my shoulder and I feel it around my scapula? And I'm kind of, oh, yeah, you know, small intestine. And, you know, I bring in some of the meridians, but that's how I usually go. And I bring a small meridian chart with me if they're interested to have a look at it. And that's actually outside my door. It's that small Masunaga one. I
Yes.
can have it here. Just a very classic general chart. And they look at it and they are interested. And it's really neat. And often they feel they get so much relief out of those 10 minutes than what they usually have when they go for an hour massage.
That's right. That's amazing.
Yeah.
What have you seen? I know it's you don't have time to diagnose them, uh, but you have a lot of experience also to diagnose or to assess very quickly.
Mhm.
What are you seeing with the doctors in the hospital setting? What kind of symptomology are you seeing? Conditions? What are they struggling with?
I mean, it's really a lot of fire water imbalance. I mean, it's just that's the stress they're at, right? When I have them on a massage chair, I like to work or just to give attention to. I'm not fully focusing on one thing. The 10 minutes are too short for that. But I try and balance out the organ zones on the back. So I like to connect small intestine and bladder or small intestine, kidney. And then even that they feel. It's actually
Mm.
really nice because they are so not can I say, preoccupied with other things. So for the first time, they experienced that, and they're just like, oh, even if you have your hands here and there, I can feel there's a difference, or I can feel they connect, and that's pretty cool. And then I
Interesting.
can explain what I'm doing. But I often see them, and yes, you see the kidney exhaustion, you see their adrenals are down, you see a lot of stomach issues just when you check. Sometimes their masks will go down a little bit, and you see it. You see the complexion of their face, of their skin. I check their hands, their fingers. You see a lot on their hands, so I do a lot of hand finger shiatsu, arm shiatsu. But often it's the way they walk in, and I'm kind of, whoa, have you been in the OR for a long time where you're standing at the table? And he was just like, how do you know? And you see their legs turned in, or there's too much pressure on one side of the leg. But that's my passion. I like to connect and I like to diagnose. And then I go from the foot up to the neck and say little things and just ask them to change their alignment a little bit or their position when they walk, and they're kind of, oh, that's different. And then they sit down, and I use points in order to support that. But the sheer fact that uh, they are surprised that I see what I see and that I can articulate it. That's actually neat.
Beautiful.
Or
There
you
must be.
Mihail, you see fingernails that are calling out loud. They could be, they have the spots on, or they could have a different shape. And I mean, that was all part of my training, to spend a lot of time on diagnosing people.
Fantastic. Sorry about that. Now, getting to know them and sharing, what are you hearing from them? What are they going through?
The best, excuse me, the best compliment I got was last week. I was treating a nurse, and then just opening neck and shoulders. And I mean, she was giving them that pause and that rest that they need just for 10 minutes. She was just in a COVID unit. She got quickly dressed and got rid of all of the protective gear, and was sitting there, and it was using some diaphragm points to help her with breathing and to let her there. And then she told me that during the demonstrations, someone threw a garbage bag at her that was filled with used masks. And she was on her way to ICU helping COVID patients. And for her, that was heartbreaking. And she was in tears, and she was still in tears telling me about that. And the demonstrations were in September. And then I gave her the treatment. We talked a little. Her breathing changed. Energetically, she changed. The shoulders relaxed. And then she just said, you know what? I think those 10 minutes are much bigger than that garbage bag they threw at me. And, and that's what it's about. I want to change that. I appreciate all the work they do. They appreciate what I do, but they are helping other people. It's a ripple effect. If we do something good, if we light the candle, the light is carried on, right? And that's, that was so beautiful. And I think I want to do that they go home, or even when they see me before their shift is over, that they're able to leave a 12-hour shift and go home and not carry the whole hospital on their shoulder.
Yeah, I mean, that's beautifully said. And doctors, and I'm sure you know better than many of us, they're a little bit like soldiers. They come, they do their job, they work the long hours, and they don't get a lot of accolades, and also don't get paid that much here. Nurses and doctors are underpaid, in my opinion. And when we need them, and we needed them through the pandemic, they've showed up, and they've worked so hard. And what is clarifying to me, that people are heroes, frontline workers, police officers, firemen, emergency response, nurses, doctors. they just don't get enough support.
That's very true, but it's also being in that environment myself for so many years as a nurse and as a physio in hospitals. Self-care is the hardest for any healthcare professional because you're so used to look after other people and you don't look after yourself. And so it's good to remind them, and it's also good from one healthcare professional to another to remind them, hey, please take care of yourself. But also, hey, I'm a professional in my way. I do shiatsu. You are looking after people, but I'm helping you out right now, and that's really nice. I would like to. I forgot at the beginning to mention though that after I've done that for a few weeks, I got in contact with the volunteer coordinator at the hospital, and I was only allowed actually to go in after being fully vaccinated, and I had to do a criminal record check and that sort of stuff. But now I'm a fully recognized volunteer, which is nice too. So I sign in, I sign out, I created, when you volunteer at the hospital, usually they have a list what you can do. I didn't fit in any list because I created that new sector, and that's fine. We call it extra duties. And they were so happy because now they know how to handle everyone else who wants to come in to support them. Could be, so that worked well. And the nice thing is too, when you are a volunteer, you have insurance, even if something happens on the way there or whatnot. So that's just on the side. So it will not be a problem to, nobody would say no if you go anywhere, either a hospital or a senior home or assisted living or wherever, and you say you want to do some good. Seniors love it. My oldest client is 92. He's just happy about how mobile and flexible he still is, which Shiatsu helps. But they, in any kind of setting, they would be happy to have you.
You hear that? Nobody will say no. So if you're thinking about, going to a hospital, if you're thinking about going to a medical setting, a senior's home, oncology department, cardiology department, nobody will say no. You just have to show up. And really, I mean, I can see Shiatsu as being a life support, in the hospital system, going, especially during difficult times, going from one department to another and just supporting the frontline workers to support the patients, right?
Even when I was employed by the hospital as a physio and I started with Shiatsu, I had funny talks with professors. They were kind of, oh, what's that? I would get prescriptions and they would say, oh, they want me or whatever I do with them, what makes them feel good. So they wouldn't use the word Shiatsu first. And then I had discussions with old professors, and I was just like, well, my best challenge was when he said, well, you diagnose him and I do. And I said, okay, let me see what I can come up with without blood work, without x-ray, with all of those tools, and then we compare. And I think that was for that particular person really the melting point, because he was very impressed. And then he committed. That's how doctors used to diagnose.
Yes.
If we find time to talk to someone, how do they talk? How is their voice? How is their appearance? How do they feel? And then you see a lot of things, and then you put it together. And it's the same in those 10 minutes. I love to listen to their voices. Do they sound exhausted? Are they very depressed? Is the voice low? And that also gives me an indication, where do I want to work on? Am I using more kidney points because they seem so depressed? Am I using more small intestine? Is heart overflowing because they are really talking very fast and very loud, and stuff like that? So you can, and Shiatsu is so beautiful because we have all of those tools besides all of the meridians and all of the acupressure points.
That's right.
We have the beautiful stretches that we can do when they sit. You can do, gosh, though, heart meridian stretches in a sitting position or pericardium, all of that. It's beautiful. It works. And that's the big thing that turns people really around, is to feel and to experience, hey, this works. And this is beautiful.
Yeah,
So
we
I think,
forget how many tools we have and how great of an educators we are. We have much more to offer than just stimulating the meridians. The assessment tools that we have too. Very few therapies have that. And,
maybe even for me as a physiotherapist, you have a client that comes in with a shoulder and you're so focused on the shoulder. And I'm now looking at the hips first, kind of how that's connect, or why do you have the pain where you have the pain? So it's good. And sometimes in those 10 minutes, people ask, and you can pass on bits and bytes of that information. And because they have a medical background, they just love to see that connection. It never occurred to them. They might
yes.
say, oh, you stand different, your shoulder might be loosen up, things like that.
Yeah,
and they even try to talk to each other, because they said it would be great for patients to have practitioners coming in to receive treatments, because the physios in the hospital setting do not have the time to do that. Which is
fantastic. So they're thinking about it now, how we can bring Shiatsu therapy to treat our patients. That's amazing. That's great.
Mm-hmm.
And how do we make that happen in your opinion? How can we make that happen? Where
it will take a while, and you need to. But I waited very long, but I'm trying to be patient. I convince one at a time, and it doesn't take much. And I think when they experience how safe but effective Shiatsu is, but also how it involves the amazing stretches and mobilizations that we offer. That is something that unfortunately physios don't do here. We used to do that in Europe. Here, I don't see a lot of physios in the hospital. They should be maybe more to do that. But in regards to Shiatsu, for them, it's just like, wow, maybe it will start first that people hire you privately to come. If they know that, I can only speak for myself, they know that I have a mobile service. I'm very selective to who I go to keep everyone safe, especially during the pandemic. And because I have clients, as I mentioned before to you, Mihail, that have ALS, MS, or really severe chronic conditions. But if they have that information, and someone asked, because if one of my friends or family members at the hospital, and you really see they would need some help, and physiotherapy is not available, then they start recommending you. I have now people calling me that a nurse recommended to call me, things like that. And that's I think that's how we get in.
Beautiful, yeah. Until I can see one day, especially maybe because of this pandemic, especially with frontline workers struggling, where hospitals have to consider within the hospital, within the medical system, how can we support our doctors and nurses better? When they see a service like Shiatsu or a therapy like Shiatsu coming in and creating such an effect, this is where we can create a niche for Shiatsu therapy in a way.
Yeah, I think ideally Shiatsu would be covered by their extended plans, and the plans that they have, from what I hear, are quite nice. So they and I encourage them to go and have regular massages, because they need body work done really badly, right? But yeah, I think that's still the one thing that for so many, ideally Shiatsu would be covered. or Shiatsu would have more, yeah, more insurance, more extended health plans would cover Shiatsu. I think that's still the big thing to, yeah, that's still the big thing.
Yes. What's next for you? What's next in the in your process working with the frontline workers?
I don't know, I want to expand it. I spent now quite some time since I'm doing that since October with ICU, with other departments, and I want to just reach out to different ones, just to. But I will keep on doing it. It's nice for them. It's nice for me. I get such a kick out of it because it's lovely, and I'm very proud of my Shiatsu training. I'm proud of Shiatsu itself and to be able to promote and do this beautiful therapy, right? So I'll see, but I will keep on working in the hospital and just reach out more and cover more. It's a big hospital, so
Good. You can maybe recruit other shiatsu therapists to join you, right? As you get busy
yeah, we
and
don't have
busy.
that many in Kelowna, so I have
Okay.
to see how we can do that. But for everyone out there, again, it can be a hospital, it can be a senior home, assisted living. I think it's just beautiful if we just go and, yeah, support, each other and other healthcare workers. And what I said at the beginning, it's for me so true that we cannot help everyone, but everyone can help someone. And I do believe right now with those crazy times that we have, that's a little contribution I want to do to keep some sort of balance and to show people there's some good out there.
Beautiful. Beautiful. When they spill over from the hospital setting and you see them maybe privately, some of the nurses and the doctors, and you get to spend obviously more time with them. What is? I mean, you mentioned the kidneys and the bladder, but what is the horror showing you? When you see them one on one.
It's a tricky one because you can't open it too soon. It's very guarded. I know out of my own experience, it has to be guarded. You can slowly just release it because there's just too much going on. And 12-hour shifts are tricky to do.
Yeah. Yeah.
So you just, I love to do some craniosacral work, mix it together with the shiatsu and just work on diaphragms and breathing. Breathing is a big one. I love to give my clients and especially healthcare workers homework with meridian stretches or alignments or even just laying on the floor 5 minutes a day. And how does your body feel? But all about body awareness and what can you do in order to feel better? Can you do a meridian stretch that I showed you? Can you use some breathing exercises? That sort of stuff. And it's good, but everyone is, that's the beauty too. Everyone is different, and every time I connect different in what I do. But when I see them privately, I do a lot of hara work as well to open it first.
Yes.
And being able to have the gate open in order to connect upper and lower body, for sure.
Beautiful. You also mentioned that you had some programs with cancer patients and chronic pain management.
Yeah, that was something that I've done pre-pandemic. They are now mostly online, and I'd like to go back to that when they are in person again. This was something that was organized by the University of Victoria, and it's called Chronic Pain Management BC. So there were some courses that I did. I think it was just a weekend, 2 weekends, and it's just a volunteer work, how we helped them go over the whole program, how you can deal with pain. And it's the whole management of pain and what you can do, all the same for cancer. And that's something I'd like to continue to in the future. Yes. Yeah.
Beautiful. And cancer patients also?
Yep. It's called Cancer Thriving and Surviving. And it's you're basically there with another co-leader, and you just coach people through certain tools, like you do brainstorming about a problem that occurs, and or ask them. It's a really interactive way of trying to lower your stress level and find solutions.
Beautiful. I want to open the floor here and on our Facebook group, maybe for some questions or comments that you might want to share or ask Monika. So if anybody here wants to add into the conversation, just raise your hand and let me know on our Facebook group. Add into the conversation, just raise your hand and let me know. Annabelle, Annelien, or Fernanda, would you like to add something?
I'm just wondering, Monika, if you always use the plinth or the chair, or do you ever use the floor, your foot on the floor?
No, not in the hospital.
Okay.
And there's hardly, often it's also just the space and it's hygiene. I don't do it, and the best is really just a massage chair or a normal chair. If you have them sit in a chair, and just the sheer fact for them to sit down for 10 minutes and someone is looking out for them, it's big. And you can sanitize the chair really well after, which I do every time. And I also treat them, I need to wear gloves. So every person and sure, we are fully masked. That's the thing, but I can't do the floor in the hospital, no.
Okay. And is that, do you have to wear the gloves, or is that a personal choice?
No, I have to. I was asked to, and it's not a big deal for me. So I never, because I'm used to it, I don't have a problem wearing a mask and wearing the gloves.
Okay. And just another question I have then, or I'm curious about, is like when you work at Shiatsu, you kind of connect with the energy of a person. I'm just wondering, when you see somebody for physiotherapy, can you easily move into a kind of a Shiatsu way of thinking, or do you know what I mean?
Because I
Always.
don't work as a Shiatsu therapist. I'm in BC, I'm not recognized as a nurse. I'm an RN and I'm a PT, but I'm recognized as a registered Shiatsu therapist. But since I'm doing Shiatsu, and that's the beauty of Shiatsu, I fully think holistically. And that was always my missing link with all the physio and all the nursing that I was doing before. That I was kind of, oh, finally, you look at someone from head to toe and you acknowledge the energy and how they look, and how things are connected. So always, I can't, why would I go back? Because this is so much better.
Okay. Thank you.
So I always think with the Shiatsu brain for sure. And the Shiatsu heart, of course.
Okay.
Thank you, Amir. Fernanda? Yeah, go ahead.
Monika, can you speak a little more about your work with the people with cancer? Because the things I have learned and I have read, there are two lines about to work with the people with cancer. Some that say that you only work in the arms and legs and don't touch in the hair. And I want to hear you about your experience with the people with cancer.
The people with cancer, that was only that volunteer work that I was doing with those workshops. I was not doing Shiatsu with them.
Ah, okay.
I have privately 2 patients. They see me, they have cancer or they had cancer. They are in remission. And one had just, it was a malignant melanoma, so it was skin cancer. And I am not touching the area, but I feel like I don't have to. There are so many anxiety issues to be solved first around that. So, and that was the client's choice too, just to work right now on just on breathing and on relaxation. But I don't have an acute cancer patient right now, so I can't speak to that. And I know it's very controversial. Some say you should
Yes.
not do it. It's the same with lymph drainage therapy. Some say in Europe, and my mom is one example, she is still having a lot of lymph drainage therapy after having cancer now 3 times. And it helps her immensely. But some people say you should not do lymph drainage or Shiatsu or any other kind of therapy when you have cancer. So I can't speak to that. If someone is in having chemo, or I don't have anyone who has chemo or who has cancer right now. So I can't help you with that information. The only cancer patients that I saw pre-pandemic was due to those courses, where it was more just, yeah, kind of a management thing, but it was not body work.
Yes, thank you. It's because I have cancer in the past, and I receive a lot of Shiatsu. It's very, very great for me. And of course, the therapists don't touch in my breast, but work all the body, and it's a very good experience. And I was, I think, 10 or 12 years ago, in the course with Saul Goodman in Croatia, and the director of the school of the Croatians, she had cancer, and she said, please treat the people with cancer because you don't know what is so good for us, and
Yes.
it's why my interest in this situation.
Beautiful.
Thank you, Monika.
Thank you, Fernanda.
I just remember when we learned, or when I went to school, cancer was at that time, and that was in the 90s, a contraindication. And I don't know if that was for liability issues. I don't know. But that's,
Yes, it's true.
I can't, that's something I can't speak to. I do not treat people with cancer. So
Yes.
I treat, but with my intuition.
Yes.
Yeah.
Yes.
Thank you.
I've treated myself many cancer patients, Fernanda, over the years, all kinds of cancers, and there's only benefits, you know, from colon cancer to breast cancer, brain, bladder, stomach.
Yeah.
Yeah, I mean, Shiatsu is very powerful, and I have collaborated with acupuncturists and herbalists that, you know, have 30, 40, 50 years of experience working with cancer. And they themselves even said that Shiatsu really helps. Yeah, Shiatsu is amazing with cancer. Yeah.
Yes, Michael, I feel because it's very controversial. I feel the people have afraid to touch with the people with cancer.
Well,
That's
so
what I feel.
that's why it's good to get training or mentorship from someone who has experience, and then that fear goes away. I mean, it's always a choice, of course, if you want to work with patients that have cancer. It's not easy. It's hard work working with cancer patients. There's a lot of trauma, and those procedures and surgeries are very traumatic. So, but luckily for me, I had no choice in the beginning, because one of my first patients was a cancer patient, and she felt so good. She felt so good after 10 minutes of chair shiatsu that I did and volunteered to do, and that she chose me as a therapist. And as I worked on her every week, through the surgeries, through the edema that she had after the surgeries, and the radiation and the chemo, she became my biggest advocate. And then she volunteered in the hospital, and she drove a lot of the cancer patients around, and she would send me all this cancer patients. So it really helps. It's just, and yes, I relied on a lot also on my intuition, but books, anything I could get my hands on at that time, and calling my teachers frequently and asking them, what do I do with this type of cancer? What do I do with this type of cancer? And you learn. Yeah, definitely.
Yeah. Thank you, Michael.
Thank you. Great question. What's next for you, Monika?
I don't know. I mean, next for me today would just be outside, and I'm looking forward to, that's my way of grounding too. I'd like to be outside. I need to do some gardening. I want to go for a long walk.
Yeah, working in those settings is extremely difficult too. I mean, it's rewarding. Volunteering in a medical setting, especially emergency settings, can be quite draining to give.
I mean, I have to say, going in there for me was easier because I know it. I've been there. So then I'm not irritated by sounds or by alarms or, you know, by whatever that's going on. And I walked some of those shoes, you know. I had someone who just had a patient that passed, and then you can really say, yeah, I know how that feels. And then you go from there. But when I do all of that work and my studies, which there's every day, there's something that's cool to read or to learn or to revisit. And I have to also admit, I just had an email conversation with my teacher in Germany, and she must be now in her 80s. And that inspired me to go back to my old books. So I'm actually reading right now my very first journal that I wrote about Shiatsu. And
that's incredible.
And that's nice to read that stuff and to read it now with the experience and with that connection that you really get with experience. I wrote how complicated I was, just writing about the triple warmer and the effects and what it does. And now you're just like, now you just do this and this and you connect that. And so it's just lovely. But that's actually what I'm doing these days, going back to so-called old stuff and look it with new eyes. And it's super, super rewarding and encouraging.
Yeah, beginner's mind. That's fantastic. And who was your teacher? Can you mention her name?
My teacher was Christel Bode. She had the International School for Bo Meridian Shiatsu in Friedrichshafen. I think 2 of her former students are teaching some of her courses now, but not sure how much he's still teaching. I'm very grateful for that. It was an excellent school, for sure.
Fantastic. And she studied with Pauline Sasaki, is that correct?
Yeah. No, not Pauline. She studied with Kawada, who was an assistant to Masunaga.
Yeah.
And it's not Pauline Sasaki, it's K Kasaki. You know what? I don't know right now.
That's
My
okay.
Apologies. I should
No
know.
problem. No problem. Well, I'm sure your family is also very proud of what you've done. You've been such a great example to your daughters. Have you had any conversations with them around that?
Sure. It was sometimes not easy for them to. I was very strict during the pandemic because of my clientele. I have clients with ALS that are bedbound, a lot of older folks and very severe chronic pain patients, and I do house calls. So they invite me to their home, and I felt I need to be even more careful and responsible to how my family and how we are during the pandemic. And it was not easy, but they understand, and it was okay. I think it's a good lesson too, to know that it's not just about me. you know, it's about other people too. And in order for me to be able to help my clients, they might be even more careful. And you know what, they did it and they're fine. And we're all good. So they like the fact, and I think it's good for them to just see that we do something for other people. And I mean, my younger daughter too helps now an older lady. So it's just something that it's good, you know. I
Yes.
mean, why not? That's how it's
Yes.
always been, right? We are a community, so we help each
Yes.
other out. And I can do that with Shiatsu, and some people can do it with other ways. But the fact is that we work with our hands, so we might as well reach out with our hands, you know.
Beautifully said. Well, that's a great way to end this episode. Thank you so much, Monika, for sharing your journey with us and sharing your experience.
Thanks for your interest.
Thank you, everyone there in our community, for joining for another great episode. Hope you have a great weekend, and we'll see you soon.